Okay, so I'm Dr. Matthew Heisey, and then we have Dr. Grove Higgins. If you want to introduce yourself briefly.
This is Dr. Grove Higgins in Colorado Springs, Colorado.
So we wanted to kind of give all of our patients and potential patients an opportunity to meet us via telehealth and kind of talk about how we can do exercises, pain reduction, preparing for procedures, how do you rehab after procedures. And so we're going to kind of talk about that here today. So what we're going to kind of cover on our webinar is what is telemedicine and telehealth, and that's basically what we're doing right now. So having a live video conferencing or having a phone call with your provider. Right now in Colorado, we're still allowed as physicians to see patients in the office, in-office examination, very basic procedures. We'll just kind of have one brief discussion on the COVID-19 update. We also have some links and self-assessment exams that we'll kind of talk about. And then Dr. Higgins will, and his team also go into a lot of our exercises at home, resources for pain relief. We'll have a question and answer at the end. And because everybody's spending time with us today, we want to make sure everybody has a courtesy 10-minute telehealth consult with myself or Dr. Higgins moving forward. Dr. Higgins, anything to add on that?
Not at this point in time. I'll save it for the end.
Okay. Well, thank you for everybody signing in. So right now, because we're at home with the coronavirus and there's shelter-in-place orders, there's a few things that we can do. And the first thing to the right is going to be the telemedicine. So new patients can still establish care with providers via Zoom conferencing, video conferencing, or even on the phone. And we've tried to remove barriers. So we're having it easy links with your cell phone or your tablet or your desktop where we can video conference and or a simple phone call with the number. We can also do a telephone conference. Physicians are also still able to see patients for appointments in the office. We're still able to do basic procedures in the exam room, trigger points, joint injections, things like that. But right now, we're not able to do any complex spine injections or any bone marrow stem cell injections. So we're kind of limited to blood platelets, prolotherapy. So because we have symptoms, because we have pain, we have those two different roads that we can help our patients with. And Dr. Grove Higgins has his telemedicine set up to help all of our patients as well and help you guys. So basically right now, because of the viral pandemic, if you will, we have kind of relaxed the communication between physicians and patients. So telemedicine is just that. And so that's going to be kind of a dogma or paradigm shift where we're able to see and establish care with our patients over this video conference or over the telephone. And so that's, again, new patients and established patients. And the way that we have it set up at the Centeno Schultz Clinic and working with neuroathlete Dr. Higgins Clinic is that we have a self-exam video that we send you a link. And then we ask our patients to kind of go through the range of motion of the neck or stretch the arm, check the fine motor control and the sensation in the hands or feet or toes or the knee or the hip. And then once we're able to do that, we get a good idea on, okay, how is that patient doing? How much is their functional impairment or their decreased joint range of motion? And that way, both the patient and the physician understand a little bit better of what's sort of ailing you or bothering the patient. And that's going to help both of us once we're able to then see you or do a procedure in office. Right now, the federal government also removed the state licensure kind of restrictions. So we can do telemedicine, telehealth in all 50 states right now. And we can also bill your insurance for that. So there really shouldn't be any large out-of-pocket costs to maintain communication with your provider. So that's kind of the overview of what telemedicine or telehealth is. It's the ability to communicate with video conferencing or a phone call with your provider and with your physician. So one question that some of our patients had was, well, how does our doctor, our physician diagnose our spine pain or joint pain through a PowerPoint on Zoom conferencing? And that goes again back to the questions that we want to ask you guys beforehand. What are your symptoms? What is the history if you're a new patient? If you're an established patient, how do we prepare and work towards the procedure in April or May? How do we prepare if we already had a procedure, but I'm not being seen in office? That's really what we're going to dive into with Dr. Higgins. Once we are able to see you guys through telemedicine or video conference, again, we want to do a little bit more of the examination, the self-assessment. And that's going to help us decide on what is needed. If Dr. Higgins has a lot of numbness down your arm, when you meet with him, he can order an MRI for you. If that same thing is in your leg, I can order an MRI. So we're still able to order imaging, x-rays, MRIs, etc. The physicians are still able to call in prescription medications or do refill medications with telehealth. So right now we're trying to remove all barriers so we can still provide the care. And so that means kind of examination, office visit, consultation, ordering tests, ordering medications. And so that's kind of all the point of the telehealth. And then again, insurance is pretty much covering all of these visits currently throughout the country. So in Colorado, we have that stay-at-home order until April 11th. And medicine, healthcare providers, physical therapy, chiropractic are still considered essential. And so that's why we have that telemedicine option for our patients. So if you do decide to stay at home, kind of here on the left side of this tab, you know, your grocery stores, your banks, your pharmacies, and then our big circle are the healthcare providers are open. So we want to make sure that all patients feel in communication with us. If we do have those numbness down the arm, numbness down the leg, severe joint pain where we start to have trouble walking around the house or trouble walking around maybe your block or your neighborhood, we do know that that degeneration can get worse. So we want to be a resource for all of our patients and each other regarding the need for imaging or self-assessment exams or home therapy exercises or medications, etc. We don't want everybody to kind of sit at home and then wait for 6 weeks to figure out why things are bothering you. So that's, again, what we're going to be able to offer through all of the physicians at Centeno Schultz Clinic, as well as Dr. Higgins and his team. Where we kind of do some in-office ultrasound or physical examination, this is a quick video demonstrating a live ultrasound, and this is a zoomed-in version. And so we're still able to see very, very good high detail. And this is the median nerve for carpal tunnel. So that's nowhere near that size in real life, but it's a very, very good zoomed in picture. So we're still able to do a lot of different techniques with in-office examination, as well as an ultrasound for a meniscus tear or shoulder bursitis or hip labrum tear or rotator cuff, ankle sprains, quadricep tendon issues. And we can even use this ultrasound for the low back. So again, this is another option for in-office visits with the physician to still learn about our diagnosis and help our patients. And that's called the musculoskeletal ultrasound. Okay, so this is just the most important thing from the CDC around the virus. The number one thing we can do for helping each other and flattening the curve is to stay at home if we have any symptoms. So even if you have mild symptoms like fevers or cough or abdominal pain, we still can do telehealth. We can still exercise at home. We can still use our supplements at home. We can call the primary care provider and ask them, where are we in testing availability in your region, location, city? We can still work with our teams of therapists and Dr. Higgins and our physicians to do telehealth as an option. So that's kind of the general guidelines from the CDC. So I do encourage all of our patients to look at the CDC guidelines. Now, if we start to have more symptoms, and what does that mean? If we have shortness of breath walking from the living room to the kitchen, mild chest pain, or we have difficulty doing activities of daily living, we absolutely want to call your primary care provider, okay? If we're having kind of more urgent symptoms, that's the only potential reason to go to the ER after you speak to your physician. Now, if we have sudden severe chest pain, type of a heart attack chest pain, if we stop breathing, then that's still going to be a normal type of call 911, call the emergency medical services to then take you to the hospital, okay? So there's kind of 3 different symptoms. And if you don't have any symptoms, that's good, but also realize that some people can have 0 symptoms and still carry this virus. They still can transmit the virus. So the most important thing to do is all of us to stay home right now if you have any symptoms. And if you don't have symptoms, then we're absolutely able to see you in our office as a physician. We are making sure that we only have one patient at a time. I was wearing my mask and gloves this morning, seeing patients. We're still able to do, again, those basic office or exam room types of procedures and injections to help with pain. Now, we do ask that the high-risk patients, people that have uncontrolled diabetes, heart failure, bad asthma, immunocompromised on medications, patients above 65, the CDC deems you high risk. So even if you have no symptoms and you're in that high-risk category, the best thing to do is still going to be to stay at home. And that's, again, why we want to make sure that we're available on video Zoom conferencing and or a telephone telehealth conferencing as resources for everybody. So that's kind of where I'm going to end for right now. This is just our contact information. We're going to switch screens, and we're going to go to Dr. Higgins for some of the exercises and the pain management that we have right now, okay?
Okay, so again, Dr. Higgins here. Going back to what Dr. Heisey was just saying on the coronavirus, right now with lots of the isolation and the anxiety going on, a lot of those same symptoms you will feel from time to time. Don't minimize symptoms and don't try to convince yourself that you don't have something, but at the same time, the chance to sit down, relax, breathe for a moment, and go through even some of the things that we're going to show you today might be able to help you get to the point where you know whether or not you should call your doctor. But yeah, what we're looking at today from the standpoint of trying to support you, there we go, is how can we help support somebody when we are in this isolated environment with rehab? And then if you have pain currently, what do you do about it? Well, Dr. Heisey already told you, call your doctor, call your physician. They will be able to help you even remotely. And since you already have a good relationship with Dr. Heisey, he has access to the full spectrum of what you would need outside of surgery currently to be able to help you. And so don't don't neglect your own personal care. But right now you're in pain, you might be in pain, or you're wanting to advance your rehabilitation. And so we want to be able to support you with that. So how can somebody like us do this? Well, we've been doing telemed for a long, long time. We work with a lot of athletes, and you see a few of them on our screen here. But then also a 50-some-year-old lady, Jerry, on the far right there. She's a healthcare practitioner, and she was providing medical care on the side of Mount Everest at 18,000 feet, and we only had access to text. So with very limited tools, there's a lot of options to help you right now. But then with the expanded suite that Dr. Heisey has available and the self-assessment modes and methods, we can get to diagnosis and treatment right now for many of the problems that you have, and then be able to go much, much deeper once the restrictions are dropped and it's safe for everybody to participate in life again. But just because life is stopped, pain does not. So one of the things that we want to talk about real quickly is when you have pain. And oh, and by the way, the guy, the shadow that keeps appearing over my shoulder here, this is our exercise therapist, Pat Marquez. He'll be doing the demonstration, but you might hear his voice pop up from time to time. But why do you have pain? There's a lot of reasons that you have pain. And one of the first concepts that you have to realize is that pain is 100% generated by the brain. Not all the things that you developed that Dr. Heisey or even myself might treat, or any orthopedist out there might end up treating, gave you pain early enough for you to pay attention to it. And for some individuals, they feel pain very early in their disease process or their injury process. So what we're looking at here is this idea that the nervous system has, for all intents and purposes, a threat bucket. It has a capacity for taking in lots of different information, sensory information, and nociception, which is basically all the bad stuff that's coming into your system. So if you've got a cut on your arm, hopefully that gets your attention, and that's something that goes into that bucket. But all of us know people that have very high pain tolerances, and they only feel a tightness. They only feel a slight discomfort in things, and other people will have very little irritation and have a large pain response. Very commonly for Dr. Heisey as well as myself, we'll see somebody with a very minor bulge in a disc and they have a lot of pain. And other people that have significant bulges in significant ways and they should have more pain than they're experiencing, and they don't. Well, why is that? Well, this pain bucket is a very simplistic explanation of this idea that your brain, your nervous system is dumping lots of information in, and at a certain point, it will start to respond and give you pain, but not early enough in some cases, and sometimes much quicker than others. So considering, again, the current time, looking at all the different stresses and disruption in life and social relationships and things like that, and then you start to add on your injury, your inflammation, your bad sleep, your bad nutrition, things like that, now that bucket gets fuller quicker. And so now pain becomes more apparent in a lot of people's lives. And if not pain, it's more tightness and more dysfunction. And so your pain can be managed by managing what we can take out of this bucket. And that's what we're going to be looking at today. So again, looking at this very simplistically, you know, here's basically how the brain does its job. It's an input-output machine by and large. And so it's taking in all of this sensory information and then making a decision if everything is good or not, and then giving you an output. You're either going to move well or you're going to move dysfunctional. You're either going to have tightness or you're going to be flexible. You're either going to be strong or weak. You're going to have pain or you won't have pain. And so if we can manage the input side of things, then the output of pain and such can be managed much, much greater. So today, that's what we're gonna do. We're going to try to help you empty that threat bucket as best as we can. All right, so here's just some things that you can manage right now that you can be doing to take stuff out of that threat bucket. Hydration, getting enough water in on a day-to-day basis, and when you're not as active and you're not talking to people and things like that, you will neglect simple things like hydration. If you know you have inflammation because you have an active injury that you've been managing or other things that you've identified with your doctors in the past, doing things to help reduce that inflammation will help considerably, because a lot of that signal is going to get into your brain, because when you move with inflammation, it can be very irritating. So the things like the curcumin with pepperine that you can get through the Centeno Schultz Clinic and Regenix is exceptionally good at that. And then there are a plethora of medications that, again, Dr. Heisey can advise you on. Nutrition is very broad, but one very simple thing, especially since your activity levels for most of us are not very high right now, on top of if you have an injury, you probably don't move as much. Watch your intake of sugar. Have a good, well-balanced nutritional plan in place, and then get active. Don't let your mind settle on things, especially with all the stress that's going on and the isolation that's going on. Have a daily schedule if you can't get to work. Engage in your hobbies, work, get online to social media and things like that. Whatever it is, be active. The idle hands or idle mind is the devil's playground. In this case, it's very, very true. Reduce your stress. Being social with friends and family. We all have phones and we all have online access if you're watching this, obviously. So engage in those things. Learn to breathe better, and that has two important pieces to it. One, breathing helps to reduce, good breathing reduces stress physiologically. It puts you in the parasympathetic, your rest and digest. It also enhances immune system function if you are breathing well. And so being able to breathe well potentially could help reduce your risk of severe complications from this, or at least put you in a better place to recover from this if you do get infection. And then there's a lot more, but it's going to come down to move well, move often, and that's what we're going to help you do today. So here's some very basic rules to anything that you're doing. So whether you're engaging in the rehab that you've been given before this started and now you can't get to, the exercise you've been doing, or the things that we're going to be showing you, here are the rules we want you to maintain. If you do this, the chances of you ever hurting yourself are really nil to none. All right, and then you can continue to do the movement that's going to make you feel well. So number one, no pain. It is the number one rule in this case. Pain, yes, has some good variations on it, but right now, pain, especially in the area where you know you have a problem, that knee or that back or whatnot, we don't want to do. Stretching is good, not pain. Good posture, always practice good posture. That incorporates a lot of joints. And again, remember, those joints are giving feedback to the brain. And if you are moving well, the brain will make you feel less pain, right? Constant breathing, continue to breathe. Most people, even doing simple stretches, will hold their breath in effort. We don't want to do that. We want to keep the breathing process here, and you'll watch Pat do these things. Move with precision. We're going to give you very specific things to do. Do those things very well. And then move with the least amount of tension. The things that we're going to show you today do not take a lot of effort to do. It's mobilizing joints, so that way those joints can move well. All right. And then, of course, if you have a rehab plan already, stay within the confines of your rehab plan. This is not comprehensive by any means, and so we can't speak to each individual problem that might be watching and participating in today's webinar. So we're going to be looking at these 4 areas and giving you a plethora of things. We're going to start with the movement, and then we'll talk about things you can do, ancillary things you can do to keep yourself feeling well. So anyway, real briefly, Pat Marquez is an exercise therapist, and how he and I started working together is working with wounded and injured soldiers in a group program. It had no manual therapy in it, and we were helping soldiers learn how to manage their pain through movement primarily, and it was extremely successful. So the things that you're going to be learning here today are things that we've been teaching to a lot of people in pain all over the world, literally. So we're going to start with the spine, just because it mobilizes the most number of joints anywhere, and most of us could use it. So we're going to start with a simple drill on the ground. So he's going to just find a place on the ground. And by the way, all of this will be available to you after the webinar on a free webpage that we put up. You don't have to register for it or anything. So take what you can off of this, and then we'll make sure that you have access to it going forward. So he's going to start very simply. He's got his ankles together, knees together, and his arms are going to be out to the side. And what he'll do to start this motion is he's going to, keeping the knees together, he's going to take a deep breath in, and as he breathes out, he's going to let his knees fall to one side. Now notice his ankles are stacking. That pulls that hip down, and you'll feel a stretch in the hip, the back, and possibly even into the shoulder. Now he's only going as far as he can without causing pain. For him, that's pretty far. For you, it only might be 10, 15 degrees, and that's fine. So as he comes up, he'll breathe in, and then he'll breathe out again as he drops his knees to the opposite side. And then he'll breathe in again. So as he does this, he'll constantly be breathing in as he comes up and breathing out as he goes down, allowing his spine to stretch. Now you might find that you get any pain in the hip or in the back or in the shoulder as you're doing this. Only go as far as you can without causing that pain, and usually you will feel a tightness before you feel that pain. Okay, so now we're going to go to the upper body portion of this twist, and this is part of a series called Shin Box, but this is part 1. Part 2, he's going to lay on his side facing me. He's going to keep his knees bent, hands are out in front, and what he'll do is he'll, again, take a deep breath in, and as he takes that deep breath in, he'll reach towards the ceiling, and then as he breathes out, he will reach beyond and towards the ground. And then he will repeat, breathing in as he comes up, breathing out as he comes down. For many people, this will be the most breathing you do ever when you're exercising. Now he's using very little amount of tension. He's not forcing that motion towards the ground at all. Only go as far as you can. If by chance you have a neck issue, put a pillow or a yoga block under your head and be as comfortable as you can. Tension will limit your results on this. And then of course he would roll over normally and he would do this to the opposite side. Okay, so next he's going to get up, and depending on how much time, we might show you other variations on certain things. But the next thing he's going to do is we're going to be looking at shoulder motion. So we're going to do a drill called a camshaft. Okay, so he's going to turn sideways just so you can see the motion, right? He's going to take his left arm in this case. He's going to keep the elbow straight as he can. His thumb in this case is going to be up just to begin with. And he's going to do a motion drawing, for all intents and purposes, a circle with the end of his shoulder. So this, watch this part here as it moves around. I'll keep my finger on it. He's going to move it up, forward, down, and back. Now go very slow when you're doing this. For most people, it's going to start as a very small motion because most people do not have good scapular control. We're looking at this muscle right here, but or this bone right here and these muscles here. These muscles, of course, all hang on the neck. So if you get neck pain or discomfort, a lot of times it's due to that shoulder being dysfunctional. And of course, he's going to go backwards. And notice he's not throwing his neck into the motion. He doesn't look tense anywhere. He's making a nice smooth motion. So if you're doing this and you look ratchety, and you feel like you're exactly like that, what he's doing right there, right? Then slow the motion down and make it much smaller. It will get bigger on its own. All right, and of course we do this with both arms. The position that he's in, turn forward for me. The position that he's in is with the shoulder slightly out from the body and just horizontal. If you can't get to that point and you need to go lower, that's just fine. Start where you can. Exactly. Okay, so now we're going to go to the hip. And Pat is going to do a drill for the hip. Notice he is using balance, a balance device. He is not doing this standing in the middle of the room. He is using something to give himself balance because the hip is the point. So he's going to take up a position to do what's called a hip circle. So his target hip is the right hip, and this is called an open chain hip circle. There's no load on this at all. He's standing straight and tall in his posture, and then what he's going to do, keeping his toes going forward, he's going to make a circle. So he imagines he's got a bullseye out the end of his foot there, and he's going to make nice slow circles around that bullseye. Again, it's not ratchety, it's very nice and smooth. He's not feeling a lot of tension in other places. If you start to feel tension in other places, slow the motion down and make it smaller. As it gets smaller, you'll probably find that you can relax better, and then the range of motion will improve as well. Now he can do
Grove, if I may.
Yes, please.
So, hey guys, Dr. Heise here. I think one thing also to add about this, if you do have decreased hip range of motion or back pain or sciatica, this can also be done in a chair in a seated position or laying down on your back. So I'm not sure if he was going to dive into that, but we also want to make sure that you're able to do some of these recovery type exercises without pain. That's going to help reset that neuro, muscle, brain, nerve, muscular system. So I was just kind of a little 2 cents on my part.
Yep, and that's great. And we'll have some of these variations on the page that we'll have for you as well. And so he's doing that same drill in a seated position, doing it off the end of, say, like a bed or a bar stool might make this even easier depending on what your range of motion is or what your ability is. And then he can also do this in other positions. He can do it out to the side, in the standing position much easier. He can do it behind him. You could do this off of the end of a stair or standing on a box, as long as the box will hold you, right? So there is the hip circles. Again, the hip is a fantastic joint. It's very robust, but it's tied into that spine. And when the hip is dysfunctional, there's usually things going wrong in the spine. So you really want to combine these two. And then one last area that we want to dive into that's very easy for you to start working on and keep moving well is the tibia, this is the knee joint. But specifically what we're going to do is what's called the tibial rotation drill. So what he's going to do is that the lower leg is actually able to move underneath that femur without the femur moving a lot. And most of us, unfortunately, are very well, we just don't know that we can do it, so we never do it well. We never train it, and so when the knee is painful, that motion is usually absent. So what we're looking at here is this area right through here. I've got my fingers in the little soft spots of his knee, and right below that is the tibia, the head of the head of the tibia, this long bone right there. And so if you have pain from that meniscus or from just general degeneration, that tibia rarely is moving well at all, and you could compare side to side. So what he's going to do is he's going to just gently rotate the tibia in and out. Now he's not driving this from his hip, he's driving this from his foot, and you can see how his foot is pronating or flexing a little bit and then picking up off the ground. And as he's doing that, that tibia is just shifting, rotating back and forth. Now, if you can't feel that or that motion isn't happening, we can go to the seated position and you can give yourself feedback and you can coach yourself. So he's going to feel that tibia on himself. He's going to find the soft spots on his knee and then find the top of the tibia, which feels like knuckles under your fingertips. And then his foot is going to be off the ground and he's going to rotate his tibia in and out. And as he does that, he should be able to feel that motion under his fingers. And if you are missing some of that motion, so say like you're turning in and there's not, that motion isn't happening or it feels restricted, he's going to emphasize that a little bit more. He's going to pull a little bit more. It's actually coming from your hamstrings. And he can even use his fingers to help encourage that motion a bit, right? So doing that motion just with a few repetitions can oftentimes relieve that joint quite a bit. So then doing it standing then becomes much more practical. If you can feel it in this position, then you'll be able to feel it much better in the standing position. And it also might indicate, if you can't, that foot has something to do with your knee problem. So he's going to stand back up, and we're going to talk real briefly about some other inputs that we think you can use better at home and then get more relief beyond these drills.
Okay. You see this okay?
Mm-hmm.
So Dr. Higgins had mentioned previously about the cycle of how we actually get information through sensory input to the brain. The brain has to interpret all that input and then make a decision. Then it's going to produce an output. So when the brain is worried about some of that sensory input, they output the decision that the brain makes in the process that it goes, because it's like it's like your CPU, it's the processor. So the processing that it does, if it feels threatened by some of that sensory input, it's going to produce a bad output. Now, the most obvious is pain, but stiffness is also a negative output. That is a protective mechanism of the brain. For instance, if I have super tight hamstrings, and this is as far as I can go, it's my hamstrings that are limiting me. The hamstrings themselves have no ability to be tight on their own, really. Because if they're under anesthesia, we can make you touch your toes, we can put you in full splits and things like that. It's really about the brain sending an unconscious to you, a reflexive amount of tone to those muscles to make you tight. So the way the brain often puts the brakes on people are stiffness, also weakness, meaning that you don't have the amount of, the brain's going to act like a governor on a car engine that only lets you go up to a certain mile per hour. It's going to limit how much strength output you can have as a protective mechanism. And of course, pain is the protective mechanism we're all familiar with, and we're kind of talking about here. So if we think about that cycle, sensory input to the brain, it interprets and decides what it thinks about that sensory input, and then it's producing an output. So let's just say I have a pain output. You may have, there's 100 or so people on this, right? You may have knee pain, hip pain, back pain, neck pain. If we can change the sensory input, then we can make a change to the output, but it's very individual. So one of the things that we do is go through some different sensory inputs, and you can do this at home. So if we talk about light touch, right? So you can easily take a tissue, and I'll use the example of knee pain right now. So can we see my knees?
Yes.
Okay. So if I have right knee pain, you can test yourself. It's best to have somebody else in the house test you, though. And if you close your eyes and that person does some light touch on your good knee in some different areas, and then compare that light touch on the opposite knee, you will most often find, and this doesn't just go for light touch, this goes for all the sensory inputs. You will most often find that you have decreased sensory input on the side that hurts. So what that means your brain is that area, because you have areas in your brain, you have a sensory cortex for sensing information. Every piece of your body has real estate in your brain. So when that is less sensory input, the brain basically just can't see it as well. So it gets worried about it. So just as an example, some things you can try at home to see if you apply this sensory input in and around your area of pain, you may be able to reduce the amount of pain, get more range of motion out of that area, and that kind of thing. Light touch, easiest thing to do is use a tissue, right? Hot and cold, so cold packs or warm packs. This is why some people love hot, some people love cold. It's all very individual. Vibration is another one. So I'm getting my props there, right? So we use some vibration devices, so they're like rollers that shake, but the easiest way, and I have clients do this at home all the time, is if you have an electric toothbrush, turn it on, don't put toothpaste on it, turn it on, use the bottom side of it and apply it to that area and see if you can move it with less pain through vibration. Stretch would be like what kinesiology tape is used for, which we use that a lot in here, and we've done online sessions with people how to tape themselves to find. Stretch would be if you're pulling the skin in a certain area. If my hamstrings are very painful right now, if I gently pull up on them, can I get more movement with less pain? Then stretch input is a good one for you. Deep pressure would be things like
Partner massage as well.
Right, partner massage, or if you've seen things like this, Theracanes and such, that you can use to apply a little bit of deep pressure. Obviously, you don't want to put yourself in pain, but sometimes that's really what foam rollers are doing, is applying deep pressure sensory input to areas, and so that's why people like them. Electric would be things like TENS units. So many of you are probably familiar with TENS units that have the pads that you apply on kind of the ends of muscle areas. There's some different techniques to use it, but that's basically an electric sensory input that you can use to make a change. Now, how do you use this? If you find the sensory input that was good for you, you applied the sensory input, it felt better, you could move better. What we try to do is stack that with the movements in the examples that we did here, like with the spine, the knee movements, or the hip movements, or the shoulder movements. We try to stack that sensory input. So vibration, helped. I apply vibration while I'm doing my hip circles. By stacking that sensory input, then you get kind of a double effect on there, and you are increasing that good sensory input to the brain. The brain's making a better interpretation about that sensory input, and so that's why you're getting less pain. So we try to stack sensory input with movement.
There we go. Okay. So there's a lot of information there, and you can't hope to absorb all of it at one time. And so there's a link down here at the bottom, and we'd be more than happy to send it to you and share this with you. Again, you don't have to share any information. It's on there for free, and we can expand on any of it. And then if you have questions, or if you need further guidance, that 10-minute consult that Dr. Heisey told you about, we'd be more than willing to help you through that, and then even further if necessary. So there was the other pain reducing ideas. And so like Dr. Heisey was saying, the telemedicine, our consults during this time are completely free, and you can access that, and we'll have a link for you to access that on that page. We want you to really use the tools that we just shared with you. But don't take any risks. But if you do have a situation where there is a threat to life or limb, that justifies just about any care. And so seek the care that you need. Dr. Heisey and I have already, during this time, had to get a couple of patients moving quite quickly. He was able to start with that person online, and we'll be seeing that person, I think, this coming week, to help her with her pain, not with the tool that he wants to use, but with the tool that will bridge the gap until he can. And that's a great, for somebody like me, that makes me feel very good to know that my patients can get the care they need right now. All right. We also have a neuropsychologist in-house because we are seeing a lot of patients with anxiety. So if you have pain and anxiety, the two of them can kind of become a vicious monster feeding itself. So do take care of that. And if you need help, telemedicine for psychology is very, very successful. Here's my contact information and Coach Pat Marquez. Please feel free to contact us with any questions off of today's webinar. We'd be more than happy to guide you further.
Well, we really appreciate everybody spending their lunch hour with us. So what we're going to kind of do is another version of this next week. Please email us. Our team will have the webinar contact information for you and some of these other links. I would like to expand on the feedback from everybody that attended so we can maybe do even more advanced next week perhaps, but also that's where that one-on-one consultation does come in. We're going to have that list of the supplements available as well. And just kind of in summary, we are available again for the telehealth consultation. And then the physicians still in Colorado are able to see patients in office, okay? So I'm just going to share the screen one more time for that contact information. And right now, what we would like to do is make sure that everybody does have, potential access to us for a courtesy consultation as we're at home. So maybe some more of the detailed questions or diagnosis questions, that's where that one-on-one is really going to be beneficial. Dr. Higgins?
That's fantastic. No, this was wonderful. And again, like you said, it's better than watching the news. Hopefully you can take some of this and start using it right away and giving feedback on how it was effective for you and how we can serve you even better. We look forward to going forward with this.
Thank you again. We're going to end the meeting. Please contact us or email us. The websites have all of our contact information. And then also please remember and realize that my physician partners also are at the North office, the Broomfield office for the North Colorado, Fort Collins, Boulder kind of demographic. So we're available as much as we can for you guys during this time.